Welcome to the MCAT Psych Social section. This is Premed Academy. Today we are covering how the MCAT tests psychological disorders, models, DSM-5, and prevalence. So let's hit it off. We are trying to keep this bite-sized, concise, to the point, and high yield. Our roadmap for today. So we are going to talk about the biomedical versus the biopsychosocial models, the DSM-5 and its classifications, rates and prevalence of psychological disorders, and then we're going to touch on some practice questions. So let's talk about what is a psychological disorder. The definition: it is disruptive thoughts, feelings, or actions that cause noticeable distress, impairment in functioning, or are considered deviant by the individual's culture. If we think about people that are sad or those that are depressed, we can have people that are sad, but it doesn't mean that they necessarily meet the clinical criteria to be diagnosed with major depressive disorder. In order to meet that criteria, you have to have impaired function. That means you might be hospitalized because you can't take care of yourself, or you're experiencing significant distress that does not allow you to function in normal everyday society. So that is our definition of a psychological disorder. There must be some form of significant impairment in functioning. Now let's touch on the two different models. So we have the biomedical versus the biopsychosocial models within psychology and psychiatry. So the biomedical model really focuses on physical causes of psychological disorders, things like biology, genetics, the neurotransmitters, how much serotonin you have in your system, other medical diseases that might be causing you to have a psychological disorder. And these often refer to then having biomedical solutions or taking medications to solve that particular psychological disorder. Now, on the other hand, the biopsychosocial model focuses on the biomedical aspect, but we add on psychological and social factors, like someone that might not have very good coping mechanisms. They may have had experienced past traumas in their life, and also stress, but also what does their support system look like, because society and the social supports that we have play a big role in the biopsychosocial model and the development of psychological disorders. So if we look at the biopsychosocial, we think of it as three different lenses. First, we have the body. So something can be physiologically happening, whether that's neurotransmitters, receptors, you have some predisposition to a psychiatric disorder. Then you have the mind, which is your coping mechanisms, your psychology, the way that your temperament is. And then you have society. How do your support systems show up in your life? And so, for example, if we look at depression, with the biomedical model, we consider that depression is caused because of an imbalance of serotonin within our body. But if we look at the biopsychosocial aspect, we think maybe there is a serotonin imbalance, maybe I have a genetic predisposition to be depressed. Maybe I'm also having a hard time at dealing with stress or my cognitive perceptions of the world around me, and I likely have no social support, no support system to be there for me through these hard times. So all of those things come into play into the biopsychosocial model of psychological disorder. Now, moving on to DSM-5 and diagnosing mental illness. What is the DSM-5? This is a diagnostic and statistical manual of mental disorders. It is a very thick book that has gone through many different revisions over the years, and it is used to classify symptoms that then lead to diagnosing someone with a mental disorder. And the important thing to remember is that the DSM-5 manual does not explain the cause of a particular psychological disorder. It merely allows us to use symptoms and criteria to then be able to diagnose someone with a particular psychological disorder. And fun fact, the first edition of the DSM was published in 1952 by the American Psychiatric Association. So that was the very first DSM. Now we are all the way to DSM-5. The prevalence of disorders in the US. So let's define first what prevalence means. Prevalence refers to the total number of cases of a particular disease or condition in a population at any given point in time. So here we look at this visualization, we see this total population of people, and maybe out of that total population, 1, 2, 3, 4, 5 of those people have an anxiety disorder. So that is the definition of prevalence. It is the total number of cases of that particular disorder over the entire population. Here's our equation. Prevalence equals total number of cases divided by the total population. So this answers the question of how widespread or common is this condition right now. And if we look at an example, let's say we have 40 million people in the US who are diagnosed with anxiety, and the entire US adult population is around 330 million. If we refer to our equation, what is the prevalence of anxiety disorders? So then we take our total number of cases, that would be 40 million people with anxiety disorders, over the total population, which would be 330 million. So our prevalence of anxiety disorders would be then 40 million divided by 330 million times 100, because we want it in percentage. And that gives us a prevalence of about 12.1% in the United States for anxiety disorders. And again, here we can see a table of how common these disorders are. What are the prevalences? We start with the lowest prevalence at the bottom, being anorexia nervosa at 0.1%, moving upward to OCD and schizophrenia at 1% of the total population, and then moving up and up towards bipolar around 2.6%, panic 2.7%, generalized anxiety 3.1%, PTSD 3.5%, alcohol use, major depressive disorder, social anxieties, specific phobias, and then kind of the total prevalence of all mental disorders combined in the US population would be around 26.2%. So we start from low to high. Okay, so now it's your turn to put the knowledge into practice. Practice question number 1. A student is studying two models of mental illness. One emphasizes neurotransmitter imbalance, while the other considers trauma and cultural background. Which pair correctly matches the model with its description? Is it A, biopsychosocial and neurotransmitters? Is it B, biomedical with social support? C, biomedical with neurotransmitters? And D, biopsychosocial only genetics? Take a couple seconds, think about it, choose your answer. And here we go in 3, 2, 1. And our answer here is the biomedical matches up with the neurotransmitter. Remember, biomedical means physiology, genetics, things that are tied to the body. Solutions to biomedical-based problems focus on providing patients with medications that will then, for example, solve a neurotransmitter imbalance. Practice question number 2. A public health researcher is evaluating the burden of mental health illnesses in the US based on prevalence data. Which of the following statements about schizophrenia is most accurate? A, schizophrenia affects over 10% of the US population annually. B, schizophrenia has a lower prevalence than major depressive disorder. C, schizophrenia is more common than alcohol use disorder. And D, schizophrenia is one of the most prevalent mental health disorders in the US. Take a couple seconds, think about your answer, and 3, 2, 1. The correct answer here is B. Schizophrenia has a lower prevalence than major depressive disorder. As you remember, we refer back to our table here. So you can see that at the bottom, it is least prevalent, up top, most prevalent. So schizophrenia is about 1% of the US population, whereas major depressive disorder affects approximately 6.7% of adults annually. And so although schizophrenia is quite serious and very often discussed, its prevalence is lower than that of many other psychiatric disorders like depression, like social anxiety, like alcohol use disorder, like generalized anxiety disorder. And so prevalence of schizophrenia is actually quite low. And bipolar disorder is also on the lower side at 2.6%. Key takeaway for this lesson: 1, know the difference between the biomedical and biopsychosocial models. Number 2, the DSM-5 classifies symptoms and criteria for how to diagnose a particular psychological disorder, but it does not define what causes that disorder. And 3, focus on the high prevalence disorders for your MCAT prep. Thanks so much for tuning in. Don't forget to follow and subscribe. If you found this video helpful, hit that like button. We hope to see you in the next lesson in our ongoing series. Welcome to Premed Academy, where we focus on community, education, and coaching. Stay tuned for more.